So I would have said some of the key things is to have the evidence. Be really, really clear about what problems you're trying to solve and have the evidence. The other bit of that is to make sure that you include the problems that are relevant to the services that you are dealing with. Chronic neglect is problematic for all services, including the high-level statutory services such as children's social care. So we looked to try and solve a problem across the piece, rather than just saying we'll only deal with it through a preventative approach. We also said, well, we need to take a different approach to those children who do tip up into those high-level services, because it's just as applicable there. So I think that was absolutely key.
Yeah, and I think when you're gathering that evidence, it's also the narrative that goes with it, the need to tailor that to the different audiences that you may be addressing, whether it be decision makers or other stakeholders in the system, because all of those different people have their own pressures and priorities that they're aware of, and whilst in a perfect world everyone would want to do everything that helps other agencies, we've all got our own pressures. So tailoring that message is important, finding the right buttons to press, if you like, in that process. And the other thing we were clear about was that to tackle the high-end need around the chronic neglect of a relatively small number of children, we needed to do that in the context of a much wider look at early years generally. So we've got that more consistent approach right away from universal, because we know that joint working with the NHS, there's a universal component to that. We need to acknowledge that and work with it, but understand how children and families can progress through to high levels of need, but also then importantly be able to step back down to lower levels of provision when the need is appropriately met. So seeing it as part of a whole seemed also to help.